Hi everyone, my name is Amanda. I'm one of the vet nursing tutors. I'm just going to talk to you today about indications of fluid therapy. So just focusing on when you might choose a particular fluid therapy in preparation for the vet directing the fluid plan for a patient. So here we have two patients. This is actually my two dogs. We've got Hunter to the left and we have Miggy to the right. So my question here is, which fluid for which patient? Now, in these pictures we can see that they look very, very similar. Do you think that if they were both to fall ill with diarrhea, they would have the same fluid plan? So here are some of the things in red which we need to consider here. So we can clearly see that Hunter and Miggy are likely to be very different ages. Miggy looks more like a puppy, whereas Hunter is more of a senior patient. We need to consider breed. Although they look very much the same, Miggy is a miniature dachshund, Hunter is a Huntway. We need to think about weight. Clearly these two are very different in size, and also we need to consider their condition, which is sort of connected to their age. Does Hunter have any underlying diseases or concerns that we are worried about? Whereas Miggy, she is just a puppy, so we may not see anything underlying at this stage. So in short, even with the same disease, we're not necessarily going to have the same fluid plan for these patients. So now what we want to do is we want to propose a plan. So the job of the vet nurse is to prepare and set up the fluid equipment that is required for the patient, although the vet will direct you what fluid is going to be selected. You will be a real asset to the vet clinic and to the team if you are able to know in advance some of the fluids that are available and an option for particular diseases. Something that I would recommend that you start to do at this point in the course is start yourself a fluid cheat sheet. This is one way that you could do it. You could list a condition, the fluid type options, and the reason why that fluid type would be good, and even put some contraindications to the side as a bit more information. But as we go through this PowerPoint here, I would encourage you to start building that plan based on what you're already doing in clinic. If you've had experience in the vet clinic, what has been used, what has worked, and also using your experience from the course is just start collecting all this data and placing it on a cheat sheet for yourself, so you start becoming really familiar with which fluid options are there in different cases. So let's think about a particular case that we might see in the vet clinic, congestive heart failure. So in a patient who is showing heart decompensation signs, a fluid option is needed to avoid an increase in blood volume. So if we selected a fluid that caused the patient's blood volume to increase, this could create sodium retention and edema. So for this reason, and for this patient, a low sodium fluid choice is required. We do not want to overload this patient with more sodium. So a fluid choice that would be suitable is 0.5% of sodium chloride and 2.5% of glucose. So there's a little picture of what that fluid might look like in clinic. So this fluid choice is known to be suitable for patients in heart failure due to its low sodium component, while its electrolyte content works to keep the patient well hydrated, but also preventing that fluid overload that we could see. If we had a look into Hartmann's and 0.9 sodium chloride, they have a much higher sodium electrolyte content. And high sodium concentrated fluids would push a patient with clinical signs of heart failure like tachypnea, crackling lungs and coughing well over the edge. So the result of a cough could lead to even cardiac arrest. So we want to really minimize that risk and prevent these things from ever occurring in this patient who is already so compromised. So do research what's actually inside these fluid bags and what makes them suitable for a patient's condition. So the question for this one, or for any other patient, is does the patient need a low sodium content? And if they do, we need to do some research on which fluid types has low sodium in them. So looking at another example, we have chronic renal failure. So a fluid choice here for chronic renal failure might be compound sodium lactate, and we've just got a picture of that to the right. This fluid choice is known under many other names. It's known as Ringer's lactate, lactated Ringer's, LRS, and Hartmann's. And you'll hear me say Hartmann's quite a bit because I've been in clinic where vets have often been using that name over other ones. But just be prepared if you're in clinic to know exactly what the vet is talking about when they ask for Hartmann's or LRS. You know that's compound sodium lactate. So for a patient who has been diagnosed with chronic renal failure, often urine output is really high, vomiting is present, and as a result, they are severely dehydrated. So Hartmann's, this fluid choice works to correct severe dehydration. So this would be a suitable choice. It also has a balanced electrolyte solution that has some potassium and can be helpful for correcting metabolic acidosis, which is common in the later stages of chronic renal failure. And it can cause patients to feel really nauseous. That can then lead on to the patient being inappetent and not wanting to accept any food in the clinic. So we want to prevent this. So in short, compound sodium lactate would be a really useful option because it's working alongside that chronic renal failure to support the patient in other ways as well, which is really handy. Our next case is a dog who is dehydrated. So a fluid choice here, we've got a couple, and we have already talked a bit about Hartmann's and how that works. So we already know that that's a really suitable option for correcting and replacing fluid deficits. Do keep in mind that this fluid type does contain more sodium in it than other solutions that can predispose this patient to conditions such as hypokalemia. So an important question to ask before you select a fluid choice such as Hartmann's is, why is your patient dehydrated? Will a higher sodium concentrate put the patient in danger? If yes, let's look into other options that are here. But Hartmann's I've listed here as one first good option, but we've also got 0.9% of sodium chloride and 5% of dextrose. So there are some other options that are there, and they may be more suitable if you find that your patient has some underlying things going on here as well. So it's just a matter of doing that research. So another important thing to be aware of is sometimes in clinic we are asked to place additives to our fluids to support the patient when they are low in certain aspects. So for example, the patient has low potassium chloride. We want to add that into our fluid therapy so that not only is the patient being rehydrated if that's what they require, but they're also getting those supportive additives that are going to help them improve. So we have here a supplement of potassium chloride, and potassium is essential for cell growth, for nerve impulses, muscle contraction, and cardiac function. So for a feline patient who has a potassium deficit, such as let's say a feline patient with diabetic ketoacidosis, which is the lead on from uncontrolled diabetes, the vet may ask us to add potassium chloride to our fluid bag to replace these deficits while also supporting the patient for what they require. So here is an example of 0.9% of sodium chloride. We've got that bag there. We've also got our potassium chloride, which would be added into our fluid bag. Do keep in mind that if you ever add anything into a fluid bag, we need to label that in some way to show that this has indeed got an added medication to it. So we could use something like this, an orange, bright orange medication added label, and just fill in all those details really, really clearly. Also record this on the patient's monitoring chart too. So at this point, you can start plugging in some of this information that you know so far about some conditions that are discussed here. So we've got our first one of dehydration as the condition, the fluid type options, and here in the reason section you can add in some of the things that we've talked about here, things that you already know from work placement or your experience, even online here learning this topic. So this will be very, very useful for you in clinic. This is something that I did when I first started working as a vet nurse. This was really helpful, a really helpful go-to place to just check, okay, why are we giving this particular fluid therapy? What things do I need to watch for? Or it was, what am I expecting and anticipating that the vet might need our patient to be on? I can make sure that the fluid bag is indeed in the clinic. We've got it stocked. I can also get the catheter ready and the bandaging ready. So all I need to do is connect it all up when the vet confirms what they are after. So that is just a little overview of some of the indications for particular fluid therapy options. There is heaps more, so do some research, and if you think a cheat sheet would be useful for you, definitely make one of those. Thanks everyone.